Hi y'all, this is Nicole. Something that was good about how they reported their statistics was that the author addressed every claim with a statistic and the source from which they got the statistic.
Hey, Katie here. So, going over some of the misleading information that I noticed in this podcast would be, first of all, they begun by stating that the podcast was not pro-choice or pro-life, just science. But it was definitely pro-choice. I felt like you could tell this by the language used. For example, they never referred to the baby as a baby, but always a conception, embryo, clump of cells, or fetus. And this is common among pro-choice people, although fetus is Latin for offspring or hatching of young. So that term is still referring to ultimately a baby. She also uses the word majority a lot instead of giving percentages. And I'm curious who they chose to interview and their personal beliefs, because that would definitely have an effect on how they presented information. For example, the OBGYN who was interviewed said she performed abortions when most OBGYNs will not. So also, counting ectopic pregnancies as abortion wouldn't really be considered abortion, because the pregnancy would never be able to make it to full term. The baby would die way before then, if it even was able to grow very much, and it would definitely risk the mother's life as well. Also, another statistic I felt was misleading is when she spoke about how mothers make less, don't work as much, and have less education, painting it in a negative light. But they don't talk about why this is, because after having kids, your priorities tend to change, and many mothers would prefer to stay home with their children instead of sending them to daycare, or mothers may decide to be stay-at-home moms instead of going to school, or put school or work off until the kids are of school age, which is perfectly fine and fulfilling for many women. And then one statistic I would want to verify and see how it was calculated is that 60% of women who had abortions already have kids. Was that out of the women in the abortion clinic, she asked, or overall in the United States? And I question this just because one of the pro-choice arguments you hear a lot is when the baby is considered a baby or alive. But someone who has already carried a baby, heard the heartbeat as early as 5 to 6 weeks gestation, and given birth, knows the child kicking the crap out of her on the inside is definitely alive. So just curious how they got that statistic.
Hello, it's Stephanie here. I felt like this podcast leaned more towards the pro-choice side rather than being unbiased. After reading the transcript, I became a lot more open-minded when it comes to the whole abortion aspect, but I still stand with pro-life. The things that stuck out to me were, number one, 40% of women wanted abortions for financial reasons, and that the CDC states that most abortions happen in the first 8 weeks, and the cortex develops around 26 to 28 weeks, and 99% of the abortions in the U.S. happens before then.
Hi, it's Cecila. On the topic of abortion, I have always been more pro-choice leaning, but when it came to myself, if I were to ever have to be in that position, I never really knew if I would be able to bring myself to do it. One of the main reasons was because I never really knew if the fetus would be able to feel anything. And after listening to this podcast and hearing that the nerves developed at 6 weeks aren't really able to sense pain, it definitely made me reconsider that belief that I held within myself. And another thing was I always thought that an abortion would just be a super invasive surgery. I never really considered the fact that there was a pill that you could just take it home. And I also thought that the surgical procedure was just using tongs. I didn't realize there was a suction device and everything like that. Something else that really surprised me was I always thought that a majority of the women that got abortions were young adolescent women, and I had no idea that a majority is actually mothers already. And the reason that they are getting abortions is because they can't afford to have another kid. So.